Well, Paul, thanks very much for having me. The first warning is this just isn't about Queensland or far north Queensland. This is a problem which is coming to all of Australia, especially if you live outside of a capital city. We went up to Cairns, far north Queensland recently, and what they've got there is an enormous issue at the moment where if you want to have a baby privately delivered, you can't have a privately delivered baby in the top 1,000 kilometres now of Queensland. We're talking about an area twice the size of Tasmania. The private hospital in Cairns has wrapped up its private obstetrics unit. That means people are now driving 4 hours south to Townsville. It is an enormous problem. And what we're finding now is with a dwindling number of people able to afford private obstetrics, so women who want to have or choose their own obstetrician and have greater choice when it comes to their baby, those numbers are retracting, and we're being told that possibly within 10 years, it's not fantasy to say that private obstetrics will be the realm of capital cities. Have a quick listen to this.
I think the major cities will be the last bastions of private obstetrics. What you're beginning to see is the beginning of things starting to crumble, and so of course regional areas is where you see it first, and then slowly it will come to the cities.
And we have had patients that have left Cairns. They've already left because they say they can't start a family here. They can't have the family begin the way they want to.
The big issue in Cairns, Paul, is that the obstetricians you just heard from there, they want to continue looking after their mothers at the local public hospital. But the public hospital has made it very clear that they're not welcome to do that they have a different philosophical service. They operate with midwives. They bring in a doctor and obstetrician if there's a problem. And the mums get the midwife who is on duty. They don't get to pick, and this is said to us, who is effectively between their legs. It's a crass or a crude way to put it, but that's as the obstetricians put it to us.
Alas,
It's a very, very serious issue. And if you believe in choice, if you believe in the right for a woman and a partner to decide who delivers their baby, this is an issue which you want to hear about, because if it comes to not being able to live in a region because you don't get to make that choice, it's going to be fundamentally wrong for Australia. And we don't want to see only rich people in capital cities able to decide if they can afford private health insurance. What we need to see is private health insurance for women, which is far more affordable, and you shouldn't be getting charged double the cost for obstetrics cover when, for instance, if you do risky sport or you smoke, you don't pay $1 extra, you just get your private health insurance that you want to pick. The argument here is there needs to be greater choice, greater equity, greater fairness for women. It is a fundamental issue which comes to basic human rights, Paul, and I know you're going to be on board.
No, all in, mate, all in. Because apart from anything else, right, Australia does not have, we're not supposed to have a two-tiered system. Right? We're not supposed to have a system where your access to healthcare, your access to your choice of healthcare, the professional that's with it is determinant on where you live. Now, we all know that obviously the services in Rocky or Cairns are going to be slightly different than what you can get in the southeast. But it doesn't mean you don't have the option. But also what this does is it does then create people who would otherwise be in the private system more pressure on a public system, and that has been a problem in places like Queensland.
Absolutely. And look, in the same reason you've got the right to choose a better new car or a better new house, you've also got the right to choose private health insurance should you want it. What we're starting to see, though, is the crumbling of those private services puts greater pressure on the public system. Now, the big question here is the private hospital not offering those private services because there is a shortage of women, or is there more money also to be made by replacing things like knees and hips? There's another philosophical question.
Wow. All right, all of it. We start to see it from tomorrow morning. The highlights up at skynews.com.au. Jonathan Lee, we love you, mate. Thank you very much. He's a good boy there. Kicking ass for us in our Brisbane studio and on the news service here each and every day.